Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. I have a video that's a little overdue, and it was the third segment of doing a call with an MTA local, TWU Local 100 retiree calling Aetna. And this time we were calling, and it was a very long phone call. It was about an hour and a half long, and we chopped it into 3 segments. This is the third segment. So without further delay, this is the last segment of that video in which she reveals that they have a secret list of prior authorizations that they will not reveal to us, and also that they do not accept Stony Brook University Hospital in their network.
What is the other question you guys have?
What is it, Stony Brook?
Right, Stony Brook University Hospital.
Stony Brook University Hospital. I need to know if that's in network. And I believe that's
Stony Brook?
Yes, I believe that's in Long Island, right?
Yes, Stony Brook, Long Island.
Okay, so the city is Stony Brook, right?
No.
Stony Brook, New York?
Yes, Stony Brook, New York.
Okay, give me a few.
And it's crazy that she couldn't just look that up and provide us with an answer immediately, and kept putting us on hold and listening to this horrible music, as you'll hear Sam say.
I'm going to be hearing this music all day long.
Thank you so much for holding. So yeah, we don't share our list, and they are inviting to go to Medicare.com. So probably on Medicare.com you can find a list, pre-authorization, like a list of services that require a pre-authorization.
On Medicare.com has a list of pre-authorizations?
No, they may have.
Oh, they may have.
They may have.
No.
We don't share our list. We don't publish our list.
Okay.
That is something that we cannot publish.
So you're saying,
but Medicare.com may have a list of services that require.
okay, hold on a second. Aetna Medicare is not Medicare. Aetna Medicare Advantage is not Medicare. You're a privatized plan. So
yes,
we follow Medicare guidelines. So Medicare is set out all guidelines for this plan. So this plan has a lot more coverage than original here, but we are attached to Medicare.
Right, but I don't get a prior authorization for an MRI or chemo, and you're telling me under your plan you do. So in that instance, I tend to disagree with whoever you just asked, because Medicare does not.
Okay, look, you over.
Okay, she really pissed me off here. I'm overthinking this? No, chick, I'm not overthinking this. You're telling me that you're not publishing your list of prior authorizations, and you're telling me to go to Medicare.com, which is really Medicare.gov, and go look, and maybe you'll find one there, and that they have to follow Medicare guidelines. They misuse that statement so much, it drives me crazy. Yes, they're supposed to follow the guidelines. However, due to lack of enforcement from Medicare and due to private insurers being able to make their own rules how those guidelines are followed, they get away with murder, basically, like in this situation. So she is absolutely dead wrong, 100%. Every one of these contracts that are negotiated with private employers, public employers, unions, all has a list of prior authorizations. If the organization is smart enough, like when we were beaten over their heads with the city over prior authorizations, they chose to temporarily suspend about 72% of them, but they're only temporary, and the city's paying a fee to do that, which, trust me, when they want to pull the value out of that contract, they're going to renegotiate those to save the city the $15 a month that they're paying per person for that suspension, and then, of course, try to put those prior authorizations back in every 2 years. But most other organizations are not asking or pressuring the vendor to suspend prior authorization, and you have the full list. Not to share that, actually, the judge in our case forced the last vendor, compelled them to publish that full list. And trust me, I'm sure that that would happen here if this ever goes to litigation. Let's continue.
So in the case, the provider requires a service done on the member, the provider will run benefits, and the provider will verify if that procedure requires or not pre-authorization.
But then,
Our release, where we can find that information is not a public information. There is something we don't share. For the university hospital, Stony Brook, they don't work with any plan with Aetna.
They don't work with any Aetna plan.
No,
Okay.
not even commercial.
All right,
And
Colleen.
and you heard it there. They don't work with any Aetna plan. They don't even work with their plan. They work with no Aetna plan. They don't work with Medicare Advantage. So, unfortunately, Mr. Richie Davis, that you keep insisting that this is still a plan that covers all doctors and hospitals that accept Medicare. Here is yet another factual video for you to show you, prove to you that not every hospital and doctor in America accepts Aetna Medicare Advantage or any Advantage plan. And I'm going to keep on doing this. I will keep doing this in other states. I'm going to show you that you've been lied to. You believed an insurance agent. You believed a sales pitch. And I know you wanted to, and I know that you wouldn't have thought that you would have been taken for a ride, but you were. 97% of doctors in the United States of America accept Medicare. Aetna is not Medicare. Aetna Medicare Advantage is not Medicare. They are a private alternative to Medicare, and they have a network. And even if they have out-of-network benefits, the only benefit that would apply is if the doctor accepts Medicare, which of course you'd want them to. But second, most importantly, they have to accept the plan for payment. And if they don't, guess what? You just narrowed your network. And most doctors don't want to be bothered. And even if the doctor did accept it for out-of-network payment, guess what? You just put an administrative burden on all your retirees for prior authorization, although they rename it when it's out-of-network to pre-visit confirmation. That is ridiculous to put somebody through. Rather than if they just need care, the doctor makes the decision, their doctor treats them. They don't have to go through all this administrative BS just to get health care. What you did is you believed a lie. They are lying to you, and we keep saying this.
Is that all the questions you have?
I have two more, actually. What would happen now if we wanted to go to the step doctor at Stony Brook? What would happen there?
He had a benefit out of the network as well at the same rate. But what happens with providers out of the network is sometimes they don't bill the insurance. They don't deal with billing process. So the member will require for a payment upfront, and then the member can get reimbursed for that expense up to the maximum rate allowed by the
Reimbursed. What is the procedure? If I submit you a bill for $1,000 up to the maximum of what Medicare would allow, you would just pay it, or are we going to have to fight to get that reimbursed?
I don't understand what you mean by
I mean, if we just submit a bill, you just reimburse it up to the maximum, or is there a whole approval procedure? You approve it for medical necessity, or there's some other reason?
No, I mean, okay. So If the doctor, it's just depending on the service. If the doctor will, like the jelly shot, for example, on the knee, if that shot require a pre-authorization and the doctor performed the service before how the pre-authorization and the doctor requires for a payment up front, the member will pay. The member will receive the medication. But once he filed the reimbursement, and if the shot require a pre-authorization, maybe the insurance will deny that because the procedure is have that pre-authorization on file to pay that for the shot. That's an example, right? So it's always better before get done any service of this handling, not just a doctor's office, a doctor's specialist office visit, that's standard. He doesn't have to have a pre-authorization to see a cardiologist or to see a chiropractor. We're talking about different services that are outside of the normal visit, like the shot, for example, or an MRI, or a surgery, or the chemotherapy, things like that.
So
Okay.
in-network,
The provider, you don't need a pre-authorization for that.
no, I understand that, but for tests or procedures, whether they're in-network or out-of-network, then they would require prior authorization?
Some of them, not all of them, some.
Even out-of-network, even an out-of-network provider?
Yeah, the in and out of the network only means if the provider has or not a contract with them.
Okay,
Got it.
so,
Is there,
so to reiterate, we would need prior authorization no matter what, whether we go to an in-network provider or an out-of-network provider, depending on the procedure. And
Depending on the service.
right,
yes.
and if I went to an out-of-network provider for a procedure and I had the authorization for it, and the bill was $1,000, but the out-of-network benefits only pay up to, let's say, $700, then I would be responsible for the other 300.
Yes, correct. And we can give you a quote, an approx quote with that service.
So now you
that
need a
service,
quote to get care.
so you can have an idea how much is going to be the maximum rate.
Oh, so with the pre-authorization, we would get the amount that you would pay towards that procedure if it was an
Yes,
out-of-network
the
doctor.
provider can give you that. Yes.
Okay.
The provider can give you that statement, or you can call us, whatever is easy for you.
let me
Okay.
ask,
They know.
let me ask you a question. In that situation that he just gave you, if we're stuck out of pocket for that remaining amount of money, does that go applied towards the maximum out of pocket?
No,
No,
No.
no,
Okay.
no.
no.
No, only the co-payment or co-insurance or co-shares advice on the
No.
contract. So it will go. Let's say if there was a specialist visit out of the network, the co-payment is $5. Only $5 will go to the maximum out of pocket. Wow.
Is there any way to
Yeah,
get a,
that's the thing with providers out of the network. But in your case, if you had, because you have this coverage because you get retired from a company, right? So that company gives the coverage to their retirees. There are other plans that people can sign up as individual. So because you're in Florida with those other coverage, you may not have chance to have treatment in New York sometimes, or visit providers in New York because they are restricted to the zip code in the area they are located. Even if they change addresses, they may need to change coverage. So your plan your medical expenses are very low in comparison to other advantages.
Your plan's crappy, but it's not as crappy as other plans.
Okay,
And the freedom your PPO has is a lot.
okay. All right,
Is there-
so
Is
not
there
to-
any,
not to keep keeping you on the phone, but I have one, go ahead, Marianne, what else you want to ask her? 'Cause I
Go
have one
ahead.
last
you,
question.
you, go ahead,
Okay.
you ask first.
Like I says, I received the 2024 Aetna outline of benefits summary book. And there's a page that says, it lists the changes from 23 to 24. One thing that confused me is there's a category here for emergency transportation worldwide. In 2023, it says emergency transportation services worldwide are not covered. In 2024, it says you pay a $50 copay for each service. And I understand that, but underneath it, it says cost sharing is not waived if you are admitted to the hospital. Do you know exactly what that might mean?
Let me go to that one. Hold on. It's the worldwide benefits, right?
Yeah, it's under emergency transportation.
Okay, so in the case you are out of the country and you had an emergency,
Okay.
for the emergency, $50 for what urgent? Okay, so the emergency and acute. Okay, so the difference between urgent and emergency, and the one that it says waive is admitted, it is the emergency one that is symptoms that may need attention immediately, like your life depends of the treatment. Okay, you have a heart attack, for example, or a stroke, things like that. And the urgent here is that you get diarrhea, for example.
Right.
Sorry, that's the first example that comes to my mind.
I understand.
But you need treatment because you don't feel good and you need medication as soon as possible. So that's the one that is not going to be waived in the case you get admitted to the hospital.
Okay.
Like if you get cholera, for example, or some kind of virus there, and you go to the hospital because you don't feel good, or you need like the medicine to get well, that's the one. But the other one is obviously you're gonna get admitted probably because the issue is kind of major.
Correct.
Issue.
Okay.
So you're gonna need to spend the night at the hospital. So you may require. So in that case, we always recommend to save all the clinical information, and so you can be able to file that claim when you come back with the proof of payment if that was the case and all of that.
Okay. All right.
Is
All
it
right. I guess.
is it possible to send us the copy you were referring to a contract before? Is it possible to send that to us so we could read it? This is
That is on his website. You said you are on the website, right?
Yes, I'm on the website. Oh,
Okay.
do I
So
go to
if you go to document,
plan overview and go to what, medical? Or plan
go to
overview?
medical, yes.
I have to click on plan overview. Okay, it says keep a digital copy. Let us know how to reach you. Take control. Okay, medical plan coverage. Get quick care options.
What's covered, and then if you see on the right side, it says statement of coverage, annual notice of changes, and evidence of coverage. You can download from there, or you can just look at it. That's your contract.
Reviewing your medical plan summary is the only thing I got. Access documents.
No, so go to plan overview,
Okay.
then medical, and then what's covered.
Yeah, okay, what's covered I could go to because it don't let me select medical. Okay, so what's covered? So I have categories of office visits, specialists, routine care, tests, diagnostic
That's the
procedures.
list. But on the little square on your right,
Oh, yes, I see. Still one that says,
plan document.
yes, I see statement of coverage or evidence of coverage.
We always use the statement of coverage. It's easier to understand. The evidence of coverage is like the whole robust document. That's your contract. But for better understanding, the statement of coverage is easy one to read. But that's your contract.
Okay.
That's the description of all your benefits.
Okay, I see it. Yeah, I could download it. Okay, great. All right. I think we've taken enough of your time today.
That's fine. That's why I am here. And if you have any questions, just let us know before you get any service. We can go over all this process, and we can contact the provider if you need more information for sure. The goal is that you get informed. Nobody likes surprises.
Okay, I appreciate your time. Thank you so much for your help.
My pleasure. Is there anything else that I can do for you today?
No.
So it was very clear. They will not share their prior authorization list, all of their details. And the Stony Brook University Hospital in Stony Brook, Long Island is not in their network, and they are not working with them. So, Mr. Davis, I am pleading with you to read your own evidence of coverage. Your EOC for 23 and 24 are up on the website. They've been on the website. We've had them for months. I've highlighted them when I shared them with your people. I've not heard back from you. I've attempted several times to reach out to you regarding that, to have those conversations. So since I've not heard back, I'm putting this video up in light of the situation and trying to share this information with your members and trying to educate everybody regarding healthcare, Medicare, and Medicare Advantage. And just because Aetna might have said that any doctor that accepts Medicare will accept this plan, that is not true. The doctor and the hospital have to accept it for payment. And it still puts an administrative burden on the retiree, even if it is out of network, and they will accept the plan for payment. And if they don't accept the plan for payment, then you are forced to pay for that physician services upfront if they're demanding payment and submit them for reimbursement. And if you hadn't adequately gone through the pre-visit confirmation, you will not get reimbursed. And no, it does not include it inside the out-of-pocket maximum. Again, factual, you've heard it here. And I have dozens of these calls. So even if you say the call taker didn't know what she was talking about, we've called back other times and we've gotten the same information. So there you go. Have a great day, everyone. Thank you for watching. Thank you for taking the time to listen and to learn. Have a great day.